Ladies, I'd like to start with a question that has been bothering me for years as I've sat across from innumerable men in my clinic, their eyes full of silent despair. Why do so many of you, nearly half of people over 60, struggle with erratic, waning erections without ever finding a lasting solution? Today, as urologist and women's health advocate Dr. Leila, who has spent 3 decades advocating for men's wellness as well, I want to shed some light on a topic that is often discussed in private. You see, I've been there for husbands, fathers, and grandfathers who have lost their confidence, and I can assure you that erectile dysfunction is more than just a natural aging process, as far too many medical professionals dismiss it. No, the root frequently stems from something much more basic, but incredibly underappreciated: vital vitamins that your body naturally produced and craved when you were younger but now finds difficult to sustain. Your vascular system fails, your hormone balance shifts, and that spark of intimacy fades when these nutrients diminish, making you doubt your own masculinity. My name is Dr. Leila, and I got started in this field by hearing the honest, human stories of patients who confided in me about their weaknesses rather than in a sterile lab. I've helped thousands of people navigate the haze of despair for more than 30 years, demonstrating to them that Mother Nature has powerful cures that we frequently overlook in favor of Band-Aid solutions or medications. I've seen men come into my office feeling defeated, only to leave feeling empowered and their relationships rekindled by using tools found on Earth. It may surprise you to learn that although synthetic drugs are the talk of the town, new research shows a kinder, more effective way, using vitamins that have been shown to restore firmness, restore circulation, and rekindle desire. Today, I'll discuss 9 vitamins that have been shown to improve sexual health by enhancing vitality and blood flow in ways that feel sustainable and natural. Here's a sneak peek that keeps my patients coming back. One of these can cause erections to noticeably improve in as little as 7 days. By the end, you'll know exactly which one to choose and how to apply it to your life, so stay put. If this speaks to you, please hit the subscribe button and ring the bell before we go any further. I'll be sharing more transformative tips on taking back your health. If this helps, please leave a 1 in the comments. If not, leave a 0 so I can improve these talks for you. I care about your voice. The first step is to comprehend how nutrient deficiencies can subtly weaken your erectile function. First, let's talk about the foundation of masculine energy, a vitamin that supports the production of hormones, strengthens your veins, and delivers the powerful performances you deserve. The foundation of masculine vigor, vitamin D, is the first item on our list. One story, when I think back on my career, sticks out like a beacon. A 62-year-old retired teacher who walked into my office with slouched shoulders, certain that his passionate days were over. "Dr. Leila," he admitted, "I've exhausted every option. Medications, workouts, dietary tweaks. Nothing sticks." I was looking over his blood work when I noticed a clear warning sign. His vitamin D was drastically declining and well below normal. I realized then that this was not the cruel joke of aging, but rather a silent thief that was stealing his essence through a deficiency that is all too common in our indoor-focused lives. Known as the sunshine nutrient, vitamin D is a powerful nutrient for men that regulates testosterone production, skeletal strength, and blood flow. It initiates the synthesis of nitric oxide, the enchanted substance that tells your blood vessels to widen and fill the penile tissues with vital blood. When nitric oxide levels are low, erections become weak or short-lived, like a stream clogged with debris. Unfortunately, a number of factors combine as we approach our 60s. Modern diets that heavily rely on processed foods are inadequate, aging kidneys convert skin synthesis less effectively, and less time spent outdoors results in decreased skin synthesis. According to research from universities like Harvard, men who have low vitamin D are up to 30% more likely to experience erectile dysfunction, which is directly related to compromised endothelial function. I've witnessed this happen time and time again in my practice. Consider that instructor. We created a plan that included fortified dairy products, fatty fish like salmon, and vitamin D supplements, with a daily goal of 2,000 to 4,000 IU. Years later, he came back beaming with 20% more testosterone, more energy, and those impromptu morning salutes that had been missing for years. He said, "It's like reclaiming a piece of my youth." in an emotionally charged voice. I added a personal touch by suggesting walks in the sun, which not only raised his energy levels but also improved his mood by using nature's healing properties. Another patient, a 70-year-old former athlete, struggled with seasonal dips. We used mushroom sources and conducted quarterly progress checks. His overall zest increased along with his erections, demonstrating that vitamin D heals the soul in addition to the body. The real momentum, however, comes from increasing circulation, even though vitamin D provides the foundation. Our next vitamin does more than just help. It electrifies blood pathways, frequently producing quick, noticeable changes. The second is niacin, also known as vitamin B3, which is a circulation accelerator. Imagine this: a gentleman in his late 60s, a devoted family man, confiding over coffee in my consultation room. Dr. Leila, my heart yearns for closeness, but my physique betrays me every time. Desire burned bright, yet his vascular network, those vital conduits to arousal, had stiffened like old pipes, restricting flow. That's when I illuminated niacin's magic, a B vitamin that acts as a natural expander, easing arterial tension and ushering in robust blood surges. Niacin's prowess lies in its vasodilatory effects. It prompts vessels to widen, enhancing delivery to extremities, including the penis, where erections hinge on hydraulic precision. If flow stutters, so does performance. Intriguingly, clinical trials, such as those in the Journal of Sexual Medicine, show niacin slashing ED symptoms in men with dyslipidemia, improving scores by 40% in weeks. Patients often sense a warm flush initially, a sign of activation, evolving into sustained vitality. For that patient, we started low, 50 milligrams daily, ramping up to avoid the flush, paired with nuts and poultry. Days in, he reported a wake-up call below the belt. Within 7 days, firmer responses emerged, aligning with research on rapid onset. This is the one I teased earlier. Niacin's speed can astonish, especially for circulation-driven issues. I recall another case, a stressed executive 65 whose high cholesterol compounded matters. Niacin not only revived his intimacy but lowered lipids, a dual win. As Dr. Leila, I emphasize balance, combined with exercise for synergy, and always consult on dosing to sidestep side effects like mild itching. But circulation alone isn't enough if neural pathways falter. Signals from brain to body must fire crisply, which brings us to a guardian of those delicate connections. Third, vitamin B9, known as folate, the neural safeguard. Nerves are the unsung heroes of arousal, the whisperers conveying touch, emotion, and intent. I once counseled a septuagenarian widower remarrying who lamented, "Dr. Leila, the flame flickers, but my body ignores it. Sensation feels muted." His labs revealed no major hormonal dips, but folate was absent, disrupting the symphony of signals. Folate orchestrates neurotransmitter function, ensuring commands zip efficiently from mind to manhood. It also tames homocysteine, a toxin that scars vessels and nerves alike. Elevated levels, per Mayo Clinic data, double ED odds in aging men. Deficiencies arise from poor greens intake or gut absorption woes common post-60. We fortified his diet with spinach, lentils, and 400 microgram supplements. Sensitivity returned in months, homocysteine dropped 25%, and he described it as rewiring my inner circuitry. Empathy drives me here. I shared analogies like a frayed phone line. Folate mends the static. Another anecdote, a diabetic patient, 68, where folate mitigated neuropathy, enhancing not just erections, but foot sensation, averting complications. Research from European urology journals backs this, linking folate to better endothelial health. With nerves protected, we need the spark to sustain it all, pure cellular energy. Fourth, vitamin B12, the vitality igniter. Exhaustion isn't just a mood killer, it's a performance saboteur. A 65-year-old grandfather once visited, not primarily for ED, but utter fatigue. "Dr. Leila, I'm drained. Can't chase grandkids, let alone connect with my partner." Blood work screamed B12 deficiency, starving his system of oxygen carriers. B12 forges red blood cells, oxygenating tissues for endurance. Low levels mean limp responses and quick fatigue. Aging guts absorb less even from meats per NIH findings. Up to 15% of seniors deficient, correlating with 50% higher ED prevalence. Supplementation, 1,000 micrograms sublingual, revived him swiftly. Weeks brought energy, then reliable firmness. I'm alive again, he grinned. I often add tales of pernicious anemia cases where B12 shots turned lives around, emphasizing injections for severe lacks. Foods like clams or fortified cereals help maintain. Energy flows, but vessels must endure. Enter the mender. Fifth, vitamin C, the vascular restorer. A patient once articulated it poignantly. Dr. Leila, my spirit pushes, but the framework crumbles. His vessels, battered by years of stress, leaked potential. Vitamin C, beyond colds, rebuilds collagen in walls, quells inflammation, and preserves nitric oxide. Oxidative damage rusts pipes. C counters it. Per studies showing 500 milligrams daily boosting flow by 20%. We dosed him with citrus and 1,000 milligram supplements. Endurance soared, erections firmed. Synergy with E amplifies, as I'll detail. Another story, a smoker, 62, where C offset tobacco harm, improving vascular scores. Protection follows repair. Sixth, vitamin E, the oxidative defender. Dr. Leila, it's like erosion from within. A 70-something described his decline. Free radicals assail cells. E neutralizes them, safeguarding vessel linings and nitric oxide. Trials indicate 400 IU cuts ED risk by 30% in at-risk men. His addition brought resilience. Armored now, he said. I tie it to heart health. E prevents clots, vital for holistic wellness. Nuts, seed sources, but calcified blockages lurk. Seventh, vitamin K2, the artery purifier. A mid-60s fitness buff puzzled, I live clean, yet stuck. Calcification rigidified arteries. K2 redirects calcium to bones, per Rotterdam study data, high intake halves hardening. Fermented foods, 100 microgram supplements cleared his paths, flow returned. Unclogged, he marveled. Underrated, yet transformative. Hormones need bolstering, too. Eighth, vitamin A, the endocrine ally. Dr. Leila, the drives vanished. A late 60s man confessed. Low A hampered testosterone. Vital for receptors per endocrine research. Deficiency drops levels 15%. Carrots, liver, 900 micrograms restored his libido. Synced again? Caution on excess. Balance key. Finally, mind-body harmony. The ninth is vitamin B6, which improves equilibrium. Intimacy was undermined by irritability. Disconnected, Dr. Leila. B6 controls hormones, dopamine, and serotonin. Anxiety-driven ED is linked to low B6. 50 milligrams daily calms and increases T. Passion returned to his calm. Whole again.